Helen Farmer with you at 2:05, and it's competition time. On Monday, the 13th of October, we are taking over Roxy Cinemas at Dubai Hills Mall for movie night with House & House, and I've got 4 seats to give away and the popcorn and the drinks to go and see Tron Heiress. So if you fancy winning today's tickets, and don't forget you have got an extra chance to win on the website, you need to tell me this. Who is behind the score for Tron Heiress? And I'm making it multiple choice. Is it Hans Zimmer or is it 9 Inch Nails? Who composed the score for Tron Heiress? Hans Zimmer or 9 Inch Nails? Let me know that on 4001. That's the SMS. You've got the ARN Play app, of course, and the WhatsApp 048715500. I do need your name on those messages, but if you've got any questions for any of our experts all the way through the afternoon and you'd rather be anonymous, that's fine too.
This is Afternoons with Helen Farmer on Dubai Eye 103.8.
Sponsored by Modern Vet. For a broken arm, you'd see a specialist, not a general practitioner. At Modern Vet, your pet sees a specialist too.
Now, we are talking animal health this hour because when your pet gets sick, it is heartbreaking, and even more so when you hear that dreaded word cancer. But modern veterinary science has meant incredible progress in oncology, and specialists like Dr. Nour from Blue Oasis and Dr. Beatriz from Modern Vet said their focus is not just on treatment, but giving pets the best possible quality of life and helping understand that cancer doesn't always mean a goodbye. So thank you both for being with us today. The text lines are open. I've already had messages for you through our social media, so get ready for some text on the other side. But Dr. Nour, can we start with the basics? You know,
Sure.
How common do you think cancer is in pets? And are there certain breeds or ages that might be more at risk?
Hello, first. Cancer, unfortunately, is common in pets. And of course, it is more common with older animals. And there are some breeds that are more predisposed to certain types of cancer, which makes them, of course, at higher risk.
Such as which ones?
Possibly golden retrievers, for example, Rottweilers. In cats, mainly light-colored cats are prone to some sort of cancer. So it depends. Each breed are predisposed to certain types of cancers.
Yeah, and all sorts of different genetic issues as well.
Of course. Of course.
This is going to sound like a really ignorant question, but, you know, we are talking, it's October, we're talking about breast cancer awareness in an hour's time. You know, are there particular organs or parts of the body that we see more in, say, cats and dogs getting cancer? You know, do you start to see patterns?
Usually it's not specific to an organ, but for example, we can see more frequent types of cancer in the skin, in the liver, in the spleen, of course, in the lungs. So there is no organ that is more at risk than other, but...
It's just important to keep on top of everything, which I wanted to ask you, Dr. Beatriz, about, you know, many owners understandably would panic when they hear that word tumour. What would be some of the red flags that there could be cancer in a pet, and what are your steps as a vet to get that potential diagnosis?
I thank you for having us today.
Pleasure.
So basically, any lump that we have recently seen or have observed that has been having some changes in the last few days or weeks, I think is something that is worth checking. Like we said, not any specific organ or only skin lumps that are at risk. So basically any type of behavior that is not really normal for your pet, this could be easily a sign of that something's not going all right. And we don't have to wait until it's like super obvious. So checking a patient, even if it's just like a senior check, so we can make sure that everything's all right, that all the analytics are doing just great. There's a lot of things that we can do when we have a tumor. If it's a skin tumor, we most probably would do fine needle aspiration. This is what we call cytology, and this is basically super easy, cheap, and fast way to get an answer.
Tell us more, Dr. about I hope I'm saying it right, cytology.
Yeah.
What is it, and why is it such an important first step for you guys as vets?
So mainly it's the least invasive, if we can say, because mainly we are just poking a very tiny needle into the lump or into the organ that we suspect that there is a tumor. And we aspirate very few, like we aspirate some cells. We put these cells on a smear. Of course, we stain it, we color it, and we evaluate the cells. So mainly here you need, of course, a cytologist. So both myself and Dr. Bia are cytologists. So we usually evaluate these smears ourselves. And it can give us, like, each type of a tumor has different types of cells. And the cells, if they are benign or they are malignant, they behave in a different way. So we can tell if it's a benign cell or if it's a malignant cell. Of course, sometimes it can be a little bit tricky. So it's not always like very straightforward. Sometimes it can be tricky. And sometimes we ask for further diagnostics. Sometimes we ask for histopathology, which is analyzing the tissue, not only the cells. So it can give us a confirmatory diagnosis. Sometimes we can ask for a CT scan for further diagnostics mainly. But with the cytology, as Dr. Bia said, it's like the first step moving forward for our diagnosis.
Dr. Nour with us today from Blue Oasis and Dr. Beatriz from Modern Vet in the studio. And ready to take your questions for 4001. We are talking about oncology in particular today. So, Dr. B, once you do confirm a diagnosis, how do you determine the stage of the disease and I guess the best treatment plan?
Yes, that is a great question. So actually, once we have the suspicion or we have a first diagnosis of cancer, we need to do the full staging for the patient. Like, where is this cancer most likely to do metastasis, to cause trouble? So we basically run the patients through this assessment through ultrasound, x-rays. Sometimes it can include, like Dr. Nour mentioned, CT scans. So we can plan for the best possible treatment plan for the patient. Sometimes this will include surgical options. Sometimes it will include only medical options. But most important is that we're going to focus always on patient quality of life. Okay, so this is what everyone needs to understand. So we lose our, we're not so scared anymore of the word cancer in pets.
And many owners, Dr. Nour, assume that, chemotherapy means suffering. And I wondered if you could perhaps explain some of the medical options for animals and I guess how well pets tolerate it, just to demystify that a little bit for us.
Exactly. Fortunately, pets tolerate cancer better than a human. For a reason that in veterinary oncology mainly, we don't go very aggressive. Mainly we use smaller dosages, we use gentler protocols to not only prolong their life, but to preserve a good quality of life and give them more years. So mainly it's to reduce the progression of the disease and to reduce the symptoms and the side effects of the cancer. So I think people usually think that chemotherapy is because they compare it to the experience in a human medicine, where they see humans losing their hair, feeling very sick. Fortunately, most of the animals, and it's very unlikely that they lose their hair or they feel really sick. Of course, we have ups and downs. It's not always a very smooth journey. We may have ups and downs, but most of the time it's very tolerable, and most of the animals tolerate it very well. So there's no need to be scared. It's one of the best things, I think, as well. Dr. Bia agrees with me, since we both started as cytologists. So when you diagnose one cancer after the other and you run out of solutions, that was the point where we decided to go for oncology studies to give patients and pets owners hope. So it's mainly hope and quality of life.
That's lovely to hear. We're going to talk about some of the other treatment options that do exist, and I guess a little bit about the emotional toll that it's not just about working with animals when you're a vet, you're working with the humans just as much. So we're turning to that. As I said, in studio, we do have Dr. Nour from Blue Oasis and Dr. Beatriz from Modern Vet. Any questions for them relating to cancer in particular today, you can reach us on 4001. Kath's been in touch. They're waiting for some cancer test results, and it's looking like their dog is going to be losing a leg. So do the experts have any insights on that? We're coming to that in just a minute.
Dubai Eye 103.8 traffic.
Sponsored by Yas Island, Abu Dhabi. Stay at iconic hotels and play at record-breaking theme parks. Book now on yasisland.com.
Coming up to 2:15. What's happening on the roads, Michael?
I hope people on the roads are in a good mood right now because several roads are or might test their patients. So sorry in advance for this update. I see heavy congestion continuing on Sheikh Zayed Road toward downtown Dubai, and I also see slowdowns on Al Khail Road and E311, especially near Al Quoz and Ras Al Khor. Between Sharjah and Dubai, it's bumper to bumper on the E11 with delays near Sahara Center and Al Nada. And if you're driving from Ibn Battuta towards Al Barsha, expect major delays, especially near the interchanges by Al Manara and Sukim. If I miss anything, let us know on 4001.
Thank you, Michael.
Dubai Eye.
103.8.
Just a little reminder that next week we are going to be out and about for Farmer's Kitchen, a very special show from Ajman, because as real estate investors look for more options around the UAE, there is one location that's capturing the attention of many a high-end buyer. So we are heading to Al Zora City in Ajman to understand how this unique coastal destination is building a reputation for luxury living, for beaches, rounds of golf, and I'm sure some foodie chat too. So Farmer's Kitchen will be live on the 17th as we look at how Al Zora City is shaping the future of real estate. The text lines are open 4001 if you need the expert advice of our two vets in the studio.
More of Afternoons with Helen Farmer is coming up next.
On the UAE's #1 talk radio station, Dubai.
It's Dua Lipa on Dubai Eye 103.8.
This is Afternoons with Helen Farmer on Dubai Eye 103.8.
Sponsored by Modern Vet. For a broken arm, you'd see a specialist, not a general practitioner. At Modern Vet, your pet sees a specialist too.
Cancer diagnosis in a beloved pet can feel devastating, shocking, but as we've been hearing, advances in veterinary oncology mean it's no longer the death sentence that perhaps it once was, and through early detection, as we've been hearing there, through cytology to imaging, tailored treatment and compassionate care, there are vets here in the UAE who are helping animals not just live longer but live really comfortable lives up until the end. So we're talking about what cancer treatment looks like for our pets and of course how we can support them and each other through it. Dr. Nour is with us from Blue Oasis and Dr. B from Modern Vet. And I wanted to ask you, Dr. B, like beyond chemotherapy we've just been talking about, are there any other treatment options that they exist? Surgery we touched on, but lifestyle changes, medical management, even things like diet and supplements and things that can support a pet at this time.
Yes, we get this question very, very often, especially since ChatGPT entered. So
Dr. AI.
Exactly, Dr. AI here. So basically, we're going to always focus on medical management, and because of all of these resources that we have, they all have very strong medical evidence and scientific evidence behind it. I'm all on board with listening to the owners' concerns and requests, but we have to understand that most of the things have not had a very strong support from the scientific community. I get the questions about like having carbohydrates cut from diets to just like starve the tumor, but it's basically going to starve the patient as well. So please don't do that. Honestly, for my patients, what I do really recommend is getting extra treats, extra love, build lovely memories and have the best quality of life possible, which often leads to my patients gaining weight every week. But it's something I'm gladly accepting as long as they're having their extra treats and love.
Thank you for that, babe. What about for the pet owners, Dr. Nour? This emotional toll of a diagnosis can feel massive. What advice do you give to people to help them cope and I guess ultimately make the best decisions for their pets? Because you work with the animals, but you're also there, person to person as well.
Yeah, true. It is really tricky and it's very emotional most of the time. And this emotional bond between the owner and the pet is it's really strong most of the time. Mm-hmm. So what makes difference, in my opinion, is the good relationship between the vet and the client.
Yeah, that trust.
The trust, yeah, it's a major factor to make everything understandable and easier for them. Mm-hmm. When they trust you, they trust that you are choosing the best options for their pets, and you have to guide them, of course. And you have to be on the same page with each other, because as we said, our goal is not to extend extend their life and extend an empty time. Our goal is to let them have a good quality of time, and they spend more time with their family, but we want this time to be happy and valuable. So we don't want them to suffer. We don't want their family members see them suffering. So once we agree to be on the same page, the journey gets smoother.
Thank you for that. We've had a message from Kath saying, hi all, we are waiting for some cancer test results, but it's looking like my dog, and in brackets says, a desert mix called Bruno, because I know Helen likes to know the names. I do, thank you for that. Does have cancer and will lose a front leg. I need to prepare us for all of this. I'd love it if your experts can share their expertise on three-legged dogs, even just minor things that could help our gorgeous boy. Please tell me. I'm not great with blood and medical things. The aftermath of the operation is quite concerning. B, what would you be saying to Kath and the family to prepare for the next stage of Bruno's life after having that procedure?
I'm so sorry to hear about Bruno's recent discoveries. Anyway, this is not the end of the world, honestly. I know that for a person to lose a limb, seems tragic, but honestly, this is one of the things that I like about this veterinary oncology, is how they teach us how to rebound from something like this. You know, like they are going to get up after this surgery, probably like 1 or 2 hours after the surgery. They're going to be standing and they're going to be running before they get the stitches off. So probably not going to be too much of a hassle for Bruno. Of course, the first few days are going to be a bit of strange for him. So he's going to need some readjustments. Maybe we can help lift the weight with a towel properly placed underneath the chest. But honestly, he'll be running in no time. And this is usually a solution that we have to control the pain, because this leg is most likely having a tumor, and this tumor is most likely causing pain. So without this leg, Bruno would be able to run, and I really mean running.
Really?
Yeah, no. You should see. There's a lot of things that we can, thanks to social media, we can also learn from other people's experience. And from our socials at Modern Vet and Blue Oasis, you're going to see lots of cases, amputated dogs with chemo, that are having a very, very nice quality of time.
The next chapter begins for Bruno. Kath, please keep us posted. And
yes, please.
Send some photos or indeed videos. I think we can squeeze in one last question. Priya saying, really good timing. My beautiful almost 13-year-old girl has got 2 fatty lumps in almost identical places behind each front leg. They've been monitored. We've had biopsies consistently showing to have no cancer cells, but they have grown considerably, and the vet wants them to be removed under general anaesthetic. Any form of draining is not an option. Any advice before or indeed after that procedure? What would you say, Nour, to Priya, who's getting ready for this beautiful old girl to have an op?
Actually, here we have to look at the importance of the surgery. If she has to really be put under anesthesia to remove this type of growth. I think if you're saying that it has been stable, like not growing in size, they have been there for a long time, every time it was checked and it's clean, it's benign. Possibly it's just like sort of a benign tumor that can be a lipoma, like a fatty tumor or fatty growth. Sometimes if we make them lose weight, we see a reduction in the size of the mass. So it's not necessarily that it has to be removed. Of course, unless the vet could see any sort of changes on cytology, some atypical changes, then of course the decision will change.
Do you know what, Priya? I will send you the details of Dr. B and Dr. Nour, because sometimes a second or indeed third opinion can really make a difference, and some of those lifestyle changes might mean little one doesn't need to go under the knife. Both, thank you so much for your time today.
Thank you for having us.
It
was a pleasure.
It really has been a message of hope. It really has. I think a lot of people feel a huge amount of distress upon hearing a diagnosis like that, but to understand that there are specialists, there are treatment options, there is so much compassion around cancer in animals here. Thank you both. So as I said, if you want to send me the word vet, I will send you the details of our vets of the hour, Dr. Nour from Blue Oasis and Dr. Beatriz from Modern Vet. Thank you guys.
Thank you.
Take care. So you can get in touch on 4001 if you'd like their details.
Your ARN News.
UAE President His Highness Sheikh Mohammed bin